Hi, Professor Sumner. Thank you very much for giving us your time today. Can you just introduce yourself and what your role is here at King's?
So my name's Andy Sumner. I'm a Professor of International Development here at King's College London. I work on issues of global poverty and inequality and economic development in developing countries, and I'm in the Department of International Development in the School of Global Affairs.
Great, thank you. So really relevant to talk to you at the moment with everything that's going on and the COVID pandemic. So could you just give us a bit of an overview about the research you've been currently doing in relation to COVID and what you found?
Yes, so we were interested to look at the impact of COVID on global poverty. And so we looked at a set of different scenarios and different economic shocks, and myself together with Chris Hoy at the Australian National University and Eduardo Ortiz-Juarez at King's College London too. What we found was in the worst case scenario, there could be a very large increase in global poverty, something in the order of 500 million people. So we were pretty surprised by that when we found that.
Absolutely. So what kind of impact are you hoping that your research will now have globally?
Well, I'm hoping there's three things that will come from this. The first is that governments around the world, and particularly those in developing countries, need to develop and expand or initiate a set of social safety net measures to ensure if there is a large poverty shock that there are programs and policies in place to help people. Secondly, I think there's a wider debate around the UN Sustainable Development Goals and universal healthcare for everyone by 2030, and that debate on financing that seems to have slipped off the agenda a bit. And that brings to the third thing that I hope comes from this, which is I think the international community needs to support countries that don't have the funds to put in place their safety nets and programs. And I think that needs to happen very quickly indeed.
So do you think that that's probably where this number has come from then, and that it will impact developing countries because they don't possibly have the funds available to kind of bring themselves out of this pandemic?
Yeah, I think so. I mean, what we found was it could be that a decade worth of global poverty reduction is actually lost because of this. And in some parts of the world, it could be 30 years of poverty reduction is lost. And so I think some countries in some developing countries have funds, but maybe not enough. Other developing countries have very little. So there's a very key role for the global community, I think, in providing concessionary finance, but also technical expertise on public health where it's useful and necessary in developing countries.
Because the cost of this is going to be substantial, and governments are going to presumably going to really struggle to pay this back and the deficit increase. So how do you think that they might be able to do that and support kind of funding that process and make it and ensuring that maybe not quite so many people do end up being pushed into poverty?
Well, I think at a national level, there's various resources that will be available to governments to reallocate from other spending, and it's also possible that existing social programs can simply be expanded, and so that the sort of setup costs are already accounted for. In terms of the advanced countries helping developing countries, I mean, there's already a discussion about the level at which that should be. Obviously, the big international financial institutions are involved. I think the important thing is whatever the new flows that a new package that's put together is, it's put together quickly. So developing countries are able to make use of the funds so that this large increase in poverty doesn't happen.
Yeah, gosh, okay. And how did you come about conducting this? Well, obviously, with your background and your area of expertise, what kind of made you start this? Was it something that came from you or from the UN?
Well, there was a discussion between the authors on how you'd actually go about thinking about a kind of an approach to making an assessment. And so we had an email exchange, and we had a further email exchange with people at the United Nations University World Institute of Development Economics Research who published the research. And they immediately saw the numbers that we did, that were going to be huge. And so once we realized the kind of potential impact on poverty, we thought it was important to put the numbers together and write a paper and publish it, and so that's what we've done.
And where do you expect that you'll take the research now?
Well, I think that there's two further avenues that I think we'll do in the near future. One is to look at the national level impact. So I think we're looking at the national data now, and you can see certain countries that are really going to have a very dramatic increase in poverty. So I think we'll write a follow-up around the national analysis and which countries that would have a really substantial impact. And then I think there's a sort of a medium-term piece of work around thinking of maybe a year or two ahead. So even when there's a vaccine, it's not clear that everyone in the world will get that or get it for free. It's quite possible that universal coverage for that vaccine won't be available for all the people in developing countries. And so that raises some question marks, I think, about how things are going to evolve, the financing for vaccine, the logistics of delivering those vaccines, and most importantly, the kind of ensuring that there's universal coverage so that we don't end up in a new world of those who are immune or vaccinated versus those who are non-immune and non-vaccinated. You can imagine those people could end up quite separated in a kind of new apartheid type ways.
Sure, and so that sounds quite likely.
Well, that's the worrying thing. I think, I mean, the assumption at the moment is the world will go back to normal once there's a vaccine. And that may be true to some extent in advanced countries where one would hope governments would pay for universal coverage. In developing countries, it's not clear to me that governments would necessarily pay for universal coverage, certainly not in the poorest countries. And so that raises a question mark about who would pay for that. But beyond the finance, there's also an issue of the logistics. I mean, you can imagine trying to deliver 7 billion vaccinations in a quick period of time. There's also questions about, not all vaccines are 100% effective. So what if the vaccine that is developed is 70% effective? How is that going to shape a new world over the next few years between those who can go back to work, can work and travel anywhere, and those who effectively almost lose their passport or their citizenship, in the sense they become marginalised because they can't afford the vaccine, and that affects their entire livelihood. So I think that's the other thing we'll be looking at next.
And where do you think in the world is going to be most problematic out of those kind of developing countries?
Well, it looks like if you look at the numbers, it looks like there'll be a very big impact in South Asia and Sub-Saharan Africa and the Middle East and North Africa. But if you go to slightly higher poverty lines, you effectively shift things bound a little bit. So it could be quite a big impact in East Asia as well. So I think in some ways the impacts are most significant in Sub-Saharan Africa, Middle East and North Africa. But actually it seems that there's very little of the developing world that will escape from this, because that's the nature of the pandemic.
Gosh, wow. Well, thank you very much for talking to us about your research, and look forward to kind of hearing a bit more about how your findings go. Professor Sumner, thank you very much.
Thank you.